Okay, so welcome to today's talk show. It's a virtual talk show, and like we also on to today's talk show. It's a virtual. Okay, so good evening, everyone. Okay, so welcome to today's talk show. It's a virtual talk show, and like we also on the message I sent, the mail I sent, we'll be talking on cholera and a collaborative approach. So we've had, quite number of cases recorded in Nigeria today. We had the one in Borno, we had the one in Lagos, and then I think in some part of Jos. Yeah, so this talk show is meant to be interactive, and permit me to introduce the guests we have. So we have Mr. Israel Egege, who's a student from the department, or rather the Faculty of Pharmaceutical Sciences, Federal University of Jos, Plateau State, and then we have Ndikata Elizabeth. She is a student of um, health management, a student of health management. And sorry, the name of your institution, ma'am, I can't recall. I've forgotten.
Okay, it's Science Professional Training and Support.
Okay. And then, thank you, ma'am. And then we have Francine Nwaki Biachinemere, who is also a student from the Department of Microbiology, Federal University of Jos, Plateau State, Nigeria, and is currently the serving Vice President of the Federation of Igbo Student Association of the same institution, that is the University of Jos chapter. It's humbling having you guys.
Thank you.
Okay, so we delve straight to today's topic. Yes, we delve straight to today's topic, and we've heard of cholera, but I want us to discuss this as though we are discussing to those who haven't heard of this cholera before. Now, having scientific background as guest, it is possible for you to just talk entirely on the scientific aspects, but then I'll love you in your contribution to narrow it down to what the common man can understand. Is that safe by all of us? Is that nice?
Yeah.
Okay, so I'll be going first with Chine Miriam. She happens to be a microbiology student, so definitely she has more understanding on this disease called cholera. So, can you tell us what cholera is about? What's cholera?
Well, good evening, everybody, once again. Cholera is a highly infectious, permit me to start with that, the highly infectious and severe diarrheal disease. We know how the entire watery stool kind of symptom people tend to associate with cholera, which is a common symptom of cholera, and it's caused by a microorganism known as Vibrio cholerae, a gram-negative, motile, rod-shaped bacterium. Speaking as a microbiologist,
yes. Exactly.
And this disease is one that has caused global concern. I think whenever a particular region is associated with cholera, or cholera is said to be endemic there, it's always an indicator of, should I say, poor social and economic development in that region, which is why you see places like Africa, or rather the continent Africa and Asia, are majorly the culprits of this. Because cholera, some of the predisposing factors are poor hygiene practices, inadequate water treatment, poor sanitation, and from these factors alone, you can see that these are pointing to these regions or these continents of the world. We are the ones who are often burdened with this, which is why cholera tends to have more ground in these regions. So cholera is something, it's actually easy to treat, but due to its endemic nature in these regions, it's now a serious cause of concern. So yeah, I think I'll stop there so I don't say everything we'll have.
Wow. Okay, yeah, thank you so much, ma'am. One thing you said that did stand out was poor social and economic developed areas. Actually, those regions that have high cases of cholera. Now, I'll be asking the question to Mr. Egege. Now, having seen these regions like Africa and Asia, to be precise, I think Nigeria, or rather sub-Saharan countries, yeah, like Nigeria and the likes, and also countries like India that over there in Asia have relatively high cases of cholera recorded per year. What do you think as individuals? What measures do you think we can employ in coping or curbing rather this disease?
Okay. Thank you so much, sir, for the privilege of speaking. Okay. Regarding this, we can, as my sister just talked about the disease being an endemic disease, so we can have diverse measures. Probably we can induce public sensitization regarding that. We can, it's something that possibly it can be. We can mostly find things like this in community that have poor provisions to facilities. And if you are trying to give this sensitization, we should not make it something that they can't afford. So it should just be like a voluntary stuff to the community. So public sensitization. But probably if we go into a community where and you have seen that many persons are infected, you can your own facilities make provision for treatment, instant treatment. Maybe they can be, as the bacteria is something that causes instant dehydration. And as time goes on, if that dehydration carries, it can lead to instant death. Because there will be imbalance of probably things in the system. Maybe it can lead to acidosis like that, and imbalance, so there will be this kind of death instantly. So if maybe as a healthcare provider, if you find yourself in those kind of communities, you can make provisions of, maybe you can have, there can be oral rehydration, instant oral rehydration, or maybe you can make intravenous fluids. Maybe you can just induce it to the persons to just make it instant. There should be an instant approach. That should be the emphasis of making those treatments work, so that to avoid that. Because if that thing lingers, if the effect of that cholera lingers, it can kill the person even within 24 hours.
Wow.
So to tell to that, maybe after making those treatments, you can now ensure adequate sensitization. You can tell the people major things, basic things about their hygiene, how to be careful on how the water they drink. Probably if you have the capacity, because our government actually is failing, and that's the essence of finances.
Wow.
If you have an organization and have the capacity, you can probably make a good bubble system for them, because for them to have good access to good water supply. Because most of these communities, if you go to check, they are drinking dirty waters, and these things are major causes. And you can just make sensitizing on probably the common thing they can easily, the way the children, you can see in some of these communities, the children will be defecating in the compounds everywhere. And all these things
that's true.
can lead to infections. Maybe in the streams that these children defecate, those same streams, those people get water from those streams and still drink water. So all these sensitization, these basic things, you can just maybe make a public awareness to the community. You can meet the elders of the community and make them to gather the people, so that you make a public enlightenment. And if those kind of communities, it will be difficult for them to gather.
Okay, so I think
what you do is that give them a treatment or give them a vaccine.
Okay. Thank you so much, sir. But then you were tilting towards the collaborative aspect of that, which I was actually getting to. But I would love to. I heard your contribution, and then we sounded there was this pharmaceutical stint in what you were saying. I'm like, no, you got to say this thing in a way, people can understand. So that being said, I would love Elizabeth to tell us what are the symptoms of this disease, and then what traditional measures or what measures can these individuals in such areas that have limited access or limited or inadequate access to pipe-borne waters and the likes. What do you think these individuals should do, and what are the symptoms of this cholera?
Thank you very much for the opportunity to participate in this initiative. Well, the symptoms of cholera ranges from mild cases to severe. Mild they don't symptoms this disease of.
Okay, hello, ma.
Can you hear me?
Yeah, there tends to be a break in communication. So I don't know if you could just do something to your volume. Yes, because I think that would be best, because the video is clear, but the audio there's a break.
But can you?
Okay, I think it's the same. But can you guys hear her, or it's from my end?
The same. I think there's a break as well.
Same thing.
Okay. Well, I think we'll just have to go with this here, but hopefully with time we expect this to get better. So you can go on, ma.
Can you hear me?
Yes, we can.
Hear me now?
Yes.
Pardon. Okay, as I was saying, I was mentioning the symptoms for cholera. I said the symptoms can range from mild to severe cases. For mild cases, victims often don't present symptoms. They are known as asymptomatic. Present symptoms for mild cases of cholera. Hello? Can you hear me?
Yes, we can.
So for severe cases, symptoms like watery diarrhea, severe vomiting, and severe dehydration and symptoms of water loss. Can you hear me? So for severe cases, okay, thank you. Patients can also have shock, and they can also die if not being treated. I think the other question you asked was the traditional approach to solving the cholera issue. That's in areas where they don't have access to good health services, right? Well, in my own point of view, I can say the best way to prevent cholera or to treat cholera, to control cholera as well in such areas is good water preservation. That's when they don't have good source of water. This water must be properly boiled and chlorinated if possible, and properly covered to prevent contamination. And for people who have already been infected for cholera, the best treatment traditionally at this stage is the oral rehydration solution. Even if you can't get it clinically, you can prepare it traditionally in your house by adding certain amounts of salt to your water and certain amounts of sugar, salt and sugar to your water. So this has been proven effective to treat cholera in so many cases where there are no access to a real oral rehydration solution. So I think it can treat cholera to some certain extent. Thank you.
Okay.
Can you hear me?
Yeah, we can hear you. It seems
Yes, we can. I think. Sir Icha. Yeah.
Okay. Steve?
I don't think he knows that his audio is on mute.
Yeah. Mr. Steve, you
Okay.
can unmute.
Sorry, I didn't mute mine. Yeah, so like you said the traditional method of treating this cholera is adding amount of salt. It's the table salt we all know, right?
Yeah.
You know, having a science student here, you need.
No, it's
So when you say salt, now you need to be
domestic salt.
okay. Wow. So it's this nice. Individuals in this area, every individual is supposed to course of study. This is definitely whether you like it or not. And then this will lead me to my second question. You all said this enlightenment should something that should be active, you know, constantly sensitizing these guys on cholera. But then I think why there is sensitization, there are still some persons that won't hear. So in such cases, what do you do? So do that, man. You answer. We start with you.
Pardon?
Me?
Yes. Hello.
All right. Okay, I'm guessing you're speaking to me, right?
Yes, I am.
Okay. So, well, even in families, there's always one person who doesn't listen. And it's very sad that in such cases, the rest of the community would have to suffer for the offense of such an individual, which is where vaccine is coming. Currently, there are oral cholera vaccines, and just the way we do with our BCG and the rest of them, I think same can be implemented for cholera, because even in Nigeria alone, from the 2nd of September 2024 to the 29th, WHO reported that there are 1,938 reported cases of cholera from Nigeria within these days. So, one, it's just going to have to be that same sensitization. It's going to be that same, because when you see the effects of this thing in your community, when you see the number of people who are dying yearly, weekly, in fact, in some places from this disease, I don't think there's anything you would be scared of dying yourself, and you'd put in the measures. It's just going to be those same simple measures of boiling your drinking water properly, defecating in the right area, because even when someone is left untreated from the disease cholera, that person can pass this disease through feces, the bacteria rather, through feces for up to 10 days, right? So we have to be careful where, and this is for areas where open defecation is still practiced. So it's just going to still be aggressive, permit me to use that word, rigorous sensitization. That word has to get to where it has to get to by all means necessary. And I don't think there's any community or there's any person who would see death and run towards death, right? Even if someone wants to commit suicide, I'm sorry for using such an analogy, but that person will look for a fast means of dying, and though cholera can kill instantly, I don't think it's going to be a means of choice for such an individual. So rigorous, aggressive sensitization on this disease, its causes, its prevention and control measures, and as well treatment, and then more focus on the oral cholera vaccine. We all have ORS, the common ORS we find even in pharmacies, that the oral rehydration salts. So once we notice someone is suffering from this, that should be the first point of call. And it's very easy to prepare. And we've also been told here that a mixture of salt and sugar in your normal water can also serve as a control measure. So I believe that I believe that it's something if all hands are put on deck, from churches to schools to community leaders to traditional heads to family heads. Once everybody is talking about the same thing, the message will be heard loud and clear by everybody. So yeah, I think that's that.
Thank you so much, ma. Yes, aggressive. You laid emphasis, the kind of strategy for enlightenment. You laid emphasis with being aggressive. Yes, so being aggressive. So it gets to a point where you want the well-being of another person, even though the person still thinks what you are doing isn't right, but you still have to use force, by fire, by force, as we say here in Nigeria. Okay, so I'll be throwing this question to Mr. Israel. So, what are those vaccines? As a as a pharmacist in the making, sir, what are those? Can treat this cholera, because we hear cases of antimicrobial resistance, and definitely, I think cholera, the Vibrio cholerae, is not exempted, because you get to see the adapt to in drugs, medications given to them. So what's the effect? What are those vaccines in the treatment of cholera presently?
Okay. All right. I will maybe I might not have much to say in this aspect, though, but I know with the little I will know from this is that from the oral vaccine, the oral vaccine in cholera, the present oral vaccine, it's actually one tremendous application in the treatment of, or in the prevention, let's say the prevention of the cholera. Then one thing I will say again regarding this is that one thing is that when the cholera affects an individual, there's always it will always destabilize the system of the person, and probably there are certain times that it will affect the acidic level of the person's immune system. There are certain times that it can lead to renal impairments, and those kind of situations like that, you can go for helping in the acidosis. Probably, maybe you can because that at that point the pH level is already affected, or the person's system. So that time, what you do is just to try to introduce a mechanism on how to improve or to increase the basis of the system of the person, so that it can annul the effect of that present state of the person. Maybe situations like you can make provision of giving the person fruits. Maybe if you will get fruits that can alter that effect, you can give fruits. Then you can go to in a hospital. Maybe there are certain times that sodium carbonate can be used for a person's system to balance the level of the acidity, because the sodium carbonate is actually a basic. So if you introduce it to the system, there will always be a balance. But it is always one that introduction of the sodium bicarbonate, it has a side effect. So it's always administered in the mild quantity if you're administering, because there's always a side effect in administering that. And so if you administer that, there's always this thing. And there are certain situations whereby there are times that in the system of that cholera patient, the electrolytes, there's always the imbalance of the electrolytes in the person's system. So what in those cases now, what you do is that the disturbance of the electrolyte, now you have to correct it by introducing the relevant electrolyte that was supposed to be in the person's system. And if you do that effect, there will always be balance, and it can restore the person back to a normal condition. And that was a little I have to add to that. Your mic is mute.
Oh, sorry. Okay, so thank you so much, sir, for that. The next question I'll be throwing to Miss Elizabeth. Yeah, so we all talked of enlightenment, and then one thing that came, on my mind whilst you were speaking was, how do we get this message across to these people in a language they will understand? Now, there are ethical concerns some individuals might have to this vaccine. So now in the Enlightenment campaign, we don't pray for bad, but then in regions where they lack, some of these basic amenities like potable water, and in regions where they have a poor development, how do you get this message across of the vaccine of cholera? How do you get this message across of the vaccine not being bad? Individuals understand that you are actually doing them good and not evil. So, Elizabeth, that's thrown to you.
Okay. Thank you for that. Before I speak on that, I would like to put the emphasis on what we are really talking about, safeguarding public health. We must first of all know who the public is. The public is you and I, everyone who lives in the community, from the community leaders, the children, the family structure, the parents, everyone who lives in the community, the government, and like I said, the community leaders. We all make up the public, and it is our health we are talking about today. So how can we get this sensitization about vaccine in the community in a way that they will understand? Well, one thing I know is people love money, people love food, people love their basic amenities, things that they cannot do without. Just like when politicians are campaigning for election, for people to vote for them during election, what they do is that they distribute money, they distribute foodstuff, things that people cannot do without. And at the end of the day, you see that they win the crowd to themselves. Well, I think we healthcare professionals, healthcare practitioners, healthcare personnel can implement this strategy as well in trying to enlightening the crowd, the public, on the importance of this vaccine. Maybe by the time you go for sensitization, you can as well go with things that you know that this community can collect. You can win their mind, their how you can win their consent. The process. You can go with food stuff. You can go with things. The time you share, they will be eager to listen to you. They will be eager to know what is that thing that you come for. What is that thing exactly that you come to tell them? What do you come to bring to them? So with this, you will be able to win their attention, and at the end of the day, majority of the population, majority of the people of the community will be vaccinated, and this cholera infection, this cholera disease will be prevented and be controlled to the barest minimum. And I think this is the best strategy to win people's attention. Can you hear me?
Yes, I can. Thank you so much, ma, for. Okay. Thank you so much, ma, for that. And now, since this combating and curbing this disease is a collaborative approach, I believe every sector, regardless of every sector, has a role to play. So both in health sector, the agri sector, the industrial sector of every nation has a part to play in curbing this, this menace in every country. So now, what policies do you think the government should create directed to Chinemere? Because I believe having been the current leader of the this leadership spirit in her, so I believe she has, a lot to say about. Okay, so wow, I'll be directing this question now to Mr. Israel. So I happen to know Mr. Israel, and he's a leader. So I believe he has a lot to say about this. Yeah. So all of us, we are going to be speaking on this. But permit me to start, Mr. M. Now, what policies do you think government should put in place to ensure that industries don't release pollutants? Because whether we like it or not, most industries, or rather some industries, release toxic waste, and these waste are released into water bodies, and then you get to see that some of these toxic waste tend to favor or aid in the growth of this Vibrio cholerae. So what policies do you think the government should put in place in curbing, the waste disposal of these industries?
Okay, all right, thank you, sir. So, this question now, the ways that government should incur so that it can be curbed. I would talk about, first of all, the government has definite authorities over everything, things that are subject under their leadership. So it is obvious that if a law is being set, and if that law is being let's say disobeyed, then it means that there can be a true judgment that should be passed. And so the government should make a policy whereby, these waste that are being discharged into our rivers, into the street. Most of all this waste, it can be recycled. Most of this industrial waste can be recycled. So they can be points whereby the government can make enlightenment to these industries, or go in contact with the core leaders of these particular industries to learn recycling. Because most of these things, if they are being disposed into the riverine systems, it affects the nature of the water, and this, as you said, this can now breed the bacteria. Yeah. So government should encourage recycling, and probably there can also be ways of encouraging incineration. That means most of this toxic waste can be set ablaze, and it should be in an incinerator whereby the carbon dioxide is directed into a particular direction. It should not be the direction should not just be a wide direction of the carbon dioxide. So it should be in an incinerator whereby the smoke or the carbon dioxide should be flowed in just one direction. And government should also set a law whereby if these companies or these industries if they disregard these structures that are being set in place, they will go under a judgment or a punishment. Probably they can have a fine to pay. They can have a fine to pay. So this thing will now put this consciousness in these persons, whereby if they are doing the disposal of these waste, it should not be anyhow to pollute the environment. I think that's the little I can say about that.
Wow. Thank you so much, sir. Thank you so much, sir. Okay, so sorry about that. A call came in. Hello?
Yes.
Hello? Are you there?
Yes, we can hear, but I don't think Mr. Steve is.
No, thank you, sir.
He left.
Yes, he just left.
Yeah, I think he mentioned that a call came in. I think it's in the process of asking, maybe trying to pick up the call to ask the person to call back. Yeah, he's back.
Yeah, so sorry about that. The call came in. Yeah, so I said this a collaborative approach, and it being a collaborative approach, I laid emphasis on sectors coming together. So whether in the health sector, whether in the agriculture, agri sector, whether you are in the finance, even down to education sector, we all have a part to play. So now it's going to be on the health sector, and with Elizabeth having a background on being a student of healthcare management, I believe she has a lot to say about this. So when it comes to the health sector, what do you think healthcare workers, or rather the health sector, should do in order to curb this? Now we discussed the whole enlightenment, but amongst each personnel, healthcare personnel, what do you think the healthcare sector should do in order to curb this disease?
Well, to the best of my knowledge, I know that in the collaborative process, it begins with the government, non-governmental organization. In health, government and government agencies, as well as non-governmental organizations, including the World Health Organization, and so they formulate strategies, they formulate policies, and healthcare providers or health practitioners and healthcare professionals like medical doctors, nurses, healthcare managers, microbiologists, and others. What they are responsible is to make sure that they are being implemented, they are being followed, including the general public. For instance, the watch strategy, which was initiated by the World Health Organization. What strategy means safe drinking water, good sanitation and hygiene. This strategy was initiated by the World Health Organization. The aim is to prevent cholera and other waterborne disease. That prevents and control cholera and reduces the spread of cholera, the spread and transmission of cholera during outbreak. So the aim of this strategy is to ensure that water supply to towns, to villages, to cities are not contaminated by human feed. They also ensure improved sanitation infrastructure. Also ensure that they promote safe disposal of human. People must not dispose waste in water bodies. They must not dispose waste in drainages. And they also ensure that they promote hand washing hygiene, especially after going to toilets and before eating, because this is one of the greatest way by which cholera can be transmitted, through the hands. So they ensure that the individuals or community members with soap and good water to prevent contamination. We also ensure that other practices such as peeling food, cooking food properly with high heat are being drastically followed, are being drastically implemented now. And they also ensure that people have access to safe drinking water. People's water source must not be from sources that are reliable, sources that like tap. If tap water is a source of drinking water in the community, they must ensure that there is no leakage, because if there's leakage, this bacteria that causes cholera into the water when people get contaminated. Set have been made for people to follow. So the role of healthcare providers in this condition, ensure that these strategies are being followed, continuous adherence to this policy from cholera and as well. Thank you.
Oh, thank you so much, man. Thank you so much, man. strict ensure compliance, yes, and adherence. And then just to chip in a little, yeah. So we have in Nigeria, primary healthcare centers, yes. So I think one thing that should also be done is that regular webinars or seminars, yes, and programs should be organized to tell healthcare workers on the latest developments around curbing this disease cholera, because when these guys are well informed, definitely they'll up their game. So even while we have the government not being able to provide the whole thing, I believe knowledge these healthcare workers acquire during such programs like the seminars, and then some of those things can really go a long way in helping them as individuals and also the community they're serving. So that's just chipping. And then I'll be directing, thank you so much, ma, for that. So I'll be directing this question, yes, to so yes, we just talked about the industrial sector and then the healthcare sector, but now we are asking, or rather we are boiling this down now to the education sector. What do you think should be done in the area of curbing this cholera in education sectors? Yes, so in our primary schools, things like health studies should integrate it, because my primary school back then, we had a subject called basic science, so it was just elementary science, yes, but then not much was said about this disease. And I believe having to integrate such things like healthcare, or rather health studies, will go a long way. So what do you think the education sector can do in curbing this disease?
Well, as much as I'd like to blame our country for a whole lot of things, I think there are times when they are doing the right things and we should commend them. Maybe it was from your school. My school, we had basic science, and we still had physical health education. And some of these little disease, we were taught about them. We all know what happened during the period for COVID. I remember my younger sister would always come home singing this song of wash your hands, wash. So the education sector, once it comes to enlightenment, is doing a whole lot, because one of the easiest groups of people to teach and to influence positively is children. Now, this is from both primary, secondary, and the likes. Now, already, I think they've been doing a good job, because I know even during if we notice, cholera is sort of a seasonal outbreak, right? There are seasons where it is more prevalent. So my school then, I'm speaking based on my personal experience, would always ask us during those periods, oh, don't take mangoes anyhow. If you must take mango, make sure you wash them with salt and water. So sensitization for children. What we just have to say is that these we should make sure every school implements it. But I think already that is already happening. Maybe some schools tend to overlook it, right? They don't really give it or pay much attention to it, while other schools are doing their best when it comes to that. So I think it's already there in the curriculum, which is what the government has to do. That policy is there because it has been put into the curriculum for schools. It's there in the curriculum. Now it's left for the teachers to make sure they follow what is there in the curriculum, and then to also make sure that when these children, now another thing I think some schools would have to enforce or be more particular about is washing of hands in school. Now, we all know that there's a designated time for eating in these schools. Now, during those times, these children should be taught the importance of hand washing. Now, if each class can have a little hand washing spot where before the children start eating, there's like a queue or they file up to go wash their hands, to tell them the importance of hand washing. Because as simple as hand washing can be, it saves us from a whole lot of diseases. So I think that's another measure that should be enforced by schools. But the ground structure, the foundation for all this has been set already. What we should be talking about is enforcement. So the education sector has been doing a whole lot regarding that. I must give it to them. Thank you.
Yeah, thank you so much, Ma. And then you made reference to food. Yeah, so this will lead me to the last question. So we cannot discuss these sectors without adding or rather discussing agriculture, because any nation that doesn't have an agri sector, I'm telling you, the individuals there will look skinny. If not, all of them die. Yeah. So this will lead to this question now. What do you think the people or individuals, stakeholders in the agricultural sector can do? What do you think they can do in implementing, or rather, in developing systems or measures that can help curb this disease? So still you, then we'll go round.
All right. Once it comes to agriculture, now for the agricultural sector, Vibrio cholerae doesn't have that much of an impact on it. The problem with it usually comes during the processing of foods, processing and preservation of foods. I think our farmers should also be enlightened on the best ways to make sure that this farm produce gets to the consumers in good quality. Right now, when we talk about good quality, we're talking about food or farm produce that has no openings for microorganisms to get in, that is in the best condition possible. And then when it comes to the food processing industries, it is very, very important, which is where NAFDAC comes to play. I think we have that problem in Nigeria where, the process is too much. Let's overlook it. No, before we complete the process, let's just keep doing our thing. So most people just start up without the NAFDAC numbers that they should have. Now that is where we have to clamp down, because while you're making profit, you might be causing loss to the society as a whole. When we look at the environment where these people process these foods, sometimes it's something that pushes one to tears, that causes one to cry, because you're producing something that is unfit for human consumption, but because of your need for profit, you don't mind at all. So I think in cases like that, we really have to clamp down hard on some of these establishments. Once your processing facility is not up to standard, you just have to go if you know you'd not meet up, right? And when it comes to preservation as well, preservation of food, I think most of us now store food whole and keep in your freezer or your refrigerator. That is amazing, but Vibrio cholerae somehow finds its way. Certain Vibrio cholerae is not all serotypes that cause cholera. It's majorly the serotype O1 and O139. So they kind of find their way into. And one thing about this microorganism is that it adapts easily. It evolves pretty easily. So it could even still be on that food you're packing to keep in the freezer. And then when you bring it out, you don't allow this food to thaw before you eat it or before you use it. You might actually think that you're helping yourself, but you're not. You might actually just be giving this thing a free passage into you. So for the agricultural sector, I think the aspects that should be focused more on is the food processing aspect of agricultural sector and preservation of these foods. So yeah, thank you.
Wow, that's really, really extensive. We dealt extensively on that. So do anyone has anything to say, anything to contribute to what she has said?
Yeah, I want to add to what she said. Well, one thing is that farmers need to plant, and another thing is that they need to sell, they need to process. Like Francis said, they need to process their farm produce, and this produce must definitely go to the marketplaces in one way or the other. So one way we can prevent cholera transmission through this is by sensitizing market women on the importance of maintaining it in the marketplaces. Because sometimes when you go to our marketplaces, our locals, is nothing to talk about. It's nothing to talk about at all. So that sensitization, enlightening market women and women, down to even the malam that sells sugar cane and even the customers that comes to buy this food stuff, vegetables for instance, they must not cook vegetables in the market. They should take it home, wash it properly for cotton. Because cotton for cotton. Because cotton I think
Okay. So Mr. Ezra, okay, since we have an echo from your space.
Hello?
Okay, yeah. So yes, you said sensitization. One of the things you mentioned, you said it's one thing to the production aspect, and then, or rather, yes, the harvesting, and then there's also a place for conveying the produce to the market and even to industries where these guys process it. So we see it's endless actually, because when you are also considering from the aspect of a farmer, you see that how about the transporting, because we tend to see how neat is those transport those vehicles used in conveying this produce. So I think it's endless. So Mr. Israel, is there anything you have to chip into what the ladies have just said?
No, I don't have. Your mic is also unmuted.
Okay, so thank you everyone. So sorry about that. Thank you everyone. And then I believe the media space has a lot to do. It has a lot to do, because the epicenter of what we've discussed is just enlightenment. And then we see that whether we like it or not, directly or indirectly, the media has influence over us as individuals. So the media, by media I mean traditional media. We have newspapers. For the grannies we have, they call us Gen Zs, but I believe they are also Gen Zs that love newspapers and magazines. These hard copies. Yeah, so we have the newspapers, we have the television channels, and then we have in the 21st century. In the 21st century, we have the social media. So we need to present this idea, or rather this whole methods we've all discussed in a way that is relatable. Because what is relatable, what somebody in China or India understand, is not what somebody here in Nigeria will understand. So you see, we need to apply different methods. So every unit, or rather every region might have different methods, but then the principle is the same, passing this message out. So I believe we as individuals, we have a whole lot to do. So let's just go and preach the gospel of cleanliness, like she said, wash. I think that's a super thing, wash. So I would love us to imbibe the culture of telling people about cholera. Whether we like it or not, we have people who still won't understand. So we have a responsibility of communicating this message. This just, and I'm re-emphasizing what I said. We have the responsibility of passing this message across in a language they will understand. So we have the media space having to use different dialects. So on the plateau, the most popular tribe we see is, I think, the Birom, there are a whole lot. So on the plateau we have Birom, we have Mangu, we have what's that tribe? Oh my God, the list goes on. So when you go to so I won't be surprised because that's somebody who has spent all her life there on the plateau. So I'm not surprised. So yes, me from Benue State, I know my tribe. Igede, there's Igede, there's Idoma, there's Steve. So we have a whole lot. Not to talk of the Eastern Nigeria where we have the Igbo guys. So we have a responsibility of passing this even in our dialects. Yes. So it's a whole lot. The list is endless. So I want to take our time to say thank you guys for turning up. Thank you guys for sharing wonderful ideas. The way you guys communicated, believe me, I was really, really blessed. I got to discover new things, and I'm sure this indeed will help everybody, to help different people in methods specific to them. So thank you once more for turning up. I really appreciate. Okay. So just before we call it a wrap, so do we have anything to say? Do anyone has anything to say, or rather have anything to say?
Well, what I want to say is thank you and thank you again for this opportunity for me to contribute to my own quarter. This is a very nice initiative because a lot of people out there need to be aware of the issues that affect in public health. So public health is as long as you are concerned, as long as I am concerned. So this is a very nice initiative. I must appreciate the organizer and appreciate you for me the opportunity to participate and contribute. Thank you so much.
You're welcome, man. Thank you so much for turning up. She happens to be, we attended the same secondary school, and believe me, one thing I can vouch her for is she's a teacher. So from what she was saying, you could just see this teaching aspect of her. She tried to hide it, but then you just, overran her contributions. So thank you so much, man. It's humbling having you. Thank you so much, Miriam. Thank you so much, Miss Elizabeth. Thank you so much, Sir Israel. So like I will say again, let's go there into the world, because the real world is where we have to spread this message. Let's go there out to the world and spread this gospel of cleanliness and hygiene. And I pray God Almighty will help us do this. Thank you all for turning up. It's really humbling having you. We do this again next time. Thank you, guys.
Bye, everybody.
Bye.
Bye.